Hi everyone, is your baby girl, your sister, Lena Me with Christiana Okeke. I am live with you all. I know you never expected me, but I am here. If you are here, let's just do a little studies. This is just a quick one for people taking exam soon, this week, this month. I just decided to come on and just drop one or two tips for us. If you're here, just say hi to the host. This won't be a long video. I just want to do this for those people taking NCLEX. How are you all doing? I hope you are doing very, very good. You never expected this, but it's just a bonus. Big bonus. So if you are taking an exam this week, where that has just started yesterday, congratulations. Because I have one or two tips for you. I don't want to waste our time. If I'm here 5 minutes and nobody's studying, I'll be gone. Yes, I don't want to waste time, but if you're here, just say hi to me so I'll know you are here. I know one or two people are here already. Just say hi to the host. I'm about to give out little bonus. So if you're taking your NCLEX this weekend, this week, this month end, let's just go through a little thing. The little things you think you know, let's see if you know it. If you know the answers to some of these questions, just feel free to put it on the comment section. If you don't know it and you are writing your exam in 1 week, 2 weeks, you need to maybe kind of move your move your exam maybe a little bit further. If you don't know some of these questions I'm going to ask, let me start with the lab. I want this to be an interactive one, so if you know it, without looking it up, without checking your notes, without checking anything, you know the answer, put it out there. What is the normal RBC? That's the first question. If you know it, just type it there. These are the little things you think you know. You might know it, you might not know it. Let's just dig into it. I have a couple of questions, maybe that might get you thinking. Are you really ready for your NCLEX or not? The first question, what is the normal of RBC? You know what RBC is? Your red blood cell. What is the normal range? If you know it, put it there. What is the normal WBC? WBC, your white blood cell count. What is the normal? When you see a question and that question is telling you about someone having so range of WBC, do you know the normal? If you know it, put it there. I want to see it. What is the normal range of platelets? Do you really know what platelets does? Do you know it? If you know the answer, put it there. What is the number? The number of PTT. And what is PTT for? When you are talking about PTT, what are you looking for? Do you know the answer? I have just asked about 4 questions. If you know it, put it there. I want to see it. And what is the normal? Everybody should know the normal range of sodium. If you don't know it, I know you're not going to pass your exam. I'm sorry to say that, because everybody should know what the normal of sodium is. All right. What is potassium normal? The normal range of potassium. Today, I want to start with the lab values. I don't want to waste time. Do you know it? If you know the answer, put it out there. We are studying. And these are the little things you think you know, but you might not know it. What is the normal range for the digoxin? Have you heard that word? Have you heard of that medication? The digoxin. You must get it on your exam. It's a must. What is the normal range? Do you know? When the question asks you for the toxic level of the digoxin, do you know it? If you know it, put it out there. Nobody has put in anything, and I have asked so many questions. Okay. BUN. What is the normal range for BUN? BUN. And when you are checking for BUN, what are you actually looking for? What are you actually looking for? If you don't know it, you need to know it. What is the normal range for I'm struggling. I think I'm asking a very simple question. Okay. What is the normal level for lithium? Lithium is a medication you can never run away from. Lithium and digoxin. Yeah, you must get it on your exam day. So, what is the normal range for magnesium? Do you know that? You need to know it. And when a question is asking you for number of INR, what is the question really asking for? When do you check for INR? Is it while giving heparin or while giving Coumadin? You need to know that question. Please, if you know any of these questions I've been asking, I say please put the answers down. If you are here, just say hi to the hosts. Um, um, can you boldly like sit down without opening your book? You're going for this exam, you're going for your NCLEX. Can you boldly, like in your memory, of reading, of studying anything right now, like open any book? Do you know the 12 cranial nerves? It always shows up. Do you know the 12 cranial nerves? You need to know it. You need to know the 12 cranial nerves before you touch that piercing door. Talk more of opening that door. You need to know the 12 cranial nerves. Yes, you need to know what each of the nerves does. The olfactory, you should know what it does. The optic, you should know what it does. Oculomotor, you should know what it. You should just know the trachea, the trigeminal, or abductus, fascia. You should know all the 12 cranial nerves. If you know any of it from 1 to 12, put it there. Yeah, today I'm not giving away answer. I am asking little questions you need to know. You need to know. If you are writing your exam barely a week, 2 weeks time, do you really know the toys, the appropriate toys kids of different ages uses for their play? Do you know from birth to 1 year, that's the infancy, what kind of toys they used to play? Do you know that? If you don't know it, please push your exam a little bit further. The toddlers, the preschoolers, the school age, do you know the kind of play they engage on? If you don't know it, please, and you are writing your exam soon, push it a little bit further. I just want to run through little questions. Okay. In the latent phase of labor, what kind of breathing do you teach the woman in labor to breathe in the latent phase? If you don't know it, please, you need to know it before you touch the piercing view door. Talk more of opening it. In the active phase of labor, what kind of breathing do you as a nurse teach the pregnant woman, the woman in labor, to breathe? In the transitional phase of labor, what kind of breathing do you teach the pregnant woman to breathe? You need to know all this. And what kind of diseases require mouth breathing? What kind of diseases will a patient have? And you encourage that patient to breathe through the mouth. You need to know that. If you don't know that, I am taking it one step at a time. When you are asked to give an eye drop, when you are asked to give an eye drop, what kind of position should your patient be before you instill an eye drop? Please, you need to know it. NCLEX is big on positioning right now. Okay? And where exactly do you instill the eye drop in the eyes? You need to know it. What are the conditions? What are the conditions you do not palpate? What condition would a patient have and you don't use your hand to palpate on it? Do you know that? Please, you need to know it before you go for your exams. And when you are instilling an eardrop, what position do you have your patient on before you instill eardrop in a patient? Do you know that? You need to know that. How many nurses checks or verifies blood before transfusing blood into a patient? How many nurses will verify the blood before you transfuse blood into a patient? And when you get the blood out of the blood bank, how long between the time the blood is out of the blood bank and the transfusing time? How long should you keep a blood before you transfuse the blood? And how long should a blood be transfused? How long? What's the duration? If you know it, put the answer down. If you don't know it, please do not near the piercing view door, because you need to know it before you approach that door. Talk more of opening the doors. I have just little questions I'm asking. If you know it, please put it there. If you don't want to put the answer down, go and look it up. It means you don't know it. What do you see with a patient taking TPN? Do you even know what TPN is? Let's start with TPN. Do you know what TPN is? When a patient is on TPN, is taking TPN, what do you see with patient? What will be your concerns with patient on TPN? You need to know all these questions I am asking. Before you give the digoxin, which vital sign do you check before you give the digoxin? You need to know it. And how long do you take it is very important. That vital sign you take before you give the digoxin, how long do you take it to make it accurate? You need to know that. If, no, this is too simple. Don't want to ask that. Yeah. If a new nurse is about to carry out a procedure and she doesn't know exactly what to do, what should she do? What should that nurse do? For instance, a nurse wants to carry out a procedure, want to maybe do a wound care, or no, just do any kind of care, anything, any procedure, and she doesn't know how to do it. What should that nurse do? This is big on NCLEX right now. What should that nurse do? You need to know what the nurse should do. I said a new nurse, but let me just give this out. Please, if you see that question, a lot of people have been telling me they saw that question. What the nurse needs to do is to go read the manual of that particular procedure she wants to do. She want to do it, she don't know how to do it. She should just go look for the manual and read the process, what the manual said. Do it like this, do it like that. I just give that one as a giveaway. Please, before you start an antibiotic, make sure that you draw your blood sample before you start any antibiotic. Either the doctor prescribed a blood draw or urine sample. Make sure you get that specimen before you start an antibiotic. It doesn't matter how NCLEX make it look. It doesn't matter how urgent they make it look. Please, if there's any answer that said, first of all, draw the blood sample or get urine sample, do that, yes. Sometimes they make that question look so scary. And you're like, oh my gosh, oh my gosh. No, you don't need to panic when you see such questions. I don't want to ask, I'm just giving out tips. I'm not studying with you. We are giving out tips. When you are giving enema, how do you position a patient when you are giving an enema to a patient? You need to know that is very, 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 very important. A nurse, I don't care how they award that question, the nurse have no business, or the nurse have no business of explaining a procedure to a patient. Is the surgeon or the doctor, the physician who is doing such procedure will be the one to explain what he or she as a doctor is going to do, not a nurse. Someone told me she came across such question, not a nurse. The same thing applied to consent. When the job of the nurse is to do what? Witness. I know some question we say, and the nurse explains. Please, the nurse doesn't explain. She just sit down there. The doctor explain the procedure, what he's going to do, and she only witness the signing that yes, this person consented to do this. This patient is not on any kind of drug. Why this person consented to do this? So the nurse do not explain that. Is the work of the physician, the surgeon who is doing that procedure. Is their job to explain all the procedure to the patient. Okay. Why do you think that the elderly people get dehydrated more? All these things are fundamental. I think I'm on fundamental questions now. Why do you think that the elderly get dehydrated more? I'll give that as a giveaway. The elderly ones get dehydrated more because they have diminished sense of taste. They don't even know they are thirsty. So they forget to drink. That's why they are dehydrated. Please, when you are solving a question and you see a question that one of the choices, the answer choices said that you should give a child under 1 year cow milk, please run away from such question. You don't give a child under 1 year cow milk. Please, please do not. It causes the children to be dehydrated. That's why you don't give that. Yeah, you don't give that because the children get dehydrated. Okay. I am looking for good tip for you. For a patient with HIV, if that patient is not having like an open wound or something that you, or maybe you're not working on what you are doing for that patient will not cause splashes of water, of liquid, or anything, please, a patient with HIV disease, you only use universal precaution for such patient. Again, patient with HIV, if that patient is not having like an open wound, or what you are doing for the patient, the care you are giving will not require, will not cause any splashes, or please don't start going to put on goggles and face masks and everything, except that person have not just HIV, but with tuberculosis or other respiratory diseases. Okay. If not, this person just needs um universal precaution, just like you treat every other patient in the hospital. Yeah, imagine someone with HIV, just their HIV alone, and you are coming to take care of the patient. You are dressed like you are going to the moon. You just scare that person. You scare the hell out of that person. When a patient is on heart monitor, what do you teach that patient? When a patient is on heart monitor, what do you teach your patient? Please, if you don't know these answers, go and look it up. What do you teach a patient on heart monitor? What do you need to know that before you near the piercing view building? You need to know that. What is angina pectoris? What is angina pectoris? And what is the drug of choice to treat angina pectoris? Do you know it? Please put it there. If you don't know it, you need to look it up. And for MI, myocardial infarction, what is the medication of choice for MI? You need to know that, please. What is MI? Yeah, a lot of people mix up MI and angina pectoris. I'll give this as a giveaway this night. I'll be this early morning. Okay. Angina pectoris. Let me start with MI. MI is I want to bring it very, very low so you don't have to start looking for the meaning. I will read and I will tell you the meaning. Okay, MI is the process by which cardiac muscle is destroyed due to interruption, the interruption of insufficient blood supply for a prolonged period, which simply means that MI is when the blood is not pumping very well. There is not enough oxygen. The blood is oxygen. When there is not enough oxygen, blood going into your system, your heart, you know, that is when someone have heart attack, because there is no enough blood going down the heart. But angina pectoris is the pain you have because blood is not getting, you are not getting enough blood pumped into the heart. You see the difference. So when you hear the word angina, angina just means pain. Okay? It just means pain. And now you give nitroglycerin for the pain of the heart, and you give morphine Mona. You give muffin for MI. I think I just give that as a giveaway. Um, please. I don't want to give away all this because I use this for my private teaching, but I just needed to do something. I want to give as much as I can give for those writing their exams very, very, very soon. Please, no pernicious anemia. And what is the treatment for pernicious anemia? Please, you need to know that. Dumping syndrome. What is dumping syndrome? You need to know dumping syndrome. You need to know the position to keep a patient with dumping syndrome. When a patient with dumping syndrome eats, you need to know when this person drinks water, either with food or after food or in between food. You should know that before you near Pearson View building. Bleeding. When you see a question talking about peptic ulcer and you see bleeding, like all these first best choices question, I know some people when they see bleeding for peptic ulcer, hey, it must be that. You should understand that bleeding is normal, is the common complication for peptic ulcer. That is what you will see with peptic ulcer. Except the rest of the options you have, those patients are alive and healthy. That is when you will think about picking peptic bleeding in peptic ulcer as an answer choice. I repeat, except the other choices, the other options you have on your answers, all those patients are alive, they are healthy, they are healthy. Before you could choose peptic ulcer, bleeding in peptic ulcer as your answer choice when you are dealing with best questions. Please do not give a patient who have peptic ulcer disease. Do not choose any answer choice that have aspirin, ibuprofen, all those blood thinners that could cause bleeding is not allowed. Please, it's not recommended. Don't pick it. Please, do not pick those answers. And you please try to know the kind of stool you have with constipation. You need to know the kind of stool you have with constipation. A breastfed child, a child that is breastfed, you need to know the kind of stool, the color of stool such child will have. Is very important you know that. Yeah, a lot of people told me they encountered such question. Please, when a child is breastfed, know the kind of stool they will have, the color. And a child who is on bottle of formula, please also know the kind of stool that child will be making. It's very, very important. I know everybody knows that after a liver biopsy, that the patient should be on what side. After a biopsy, after a patient goes through biopsy of the liver, please make sure you place that person on the right side. And before or during the procedure, when the biopsy is being taken, if you see any answer that said that this is my right hand, okay, that the patient should raise their hand up, that is the answer. The patient should raise the right hand up. You, the nurse, you teach the patient to raise his or her hand up. So the physician will have all this place for himself to work on that patient. The same thing applied to when with chest tube. When a student, a patient want to get chest tube, any answer that says the patient should raise their hand off, raise it up. So the physician will have all this place for himself to do his work. Please, that is the right answer. A lot of people came asking me, oh, what should I, what do you think? That is what I think. Please. And after biopsy, nurses, what you look for is hemorrhaging. I told you, bleeding. NCLEX is not big on bleeding. Bleeding to them can be like a little cut or something. But when you hear that word hemorrhage, you know that this person is dying too. NCLEX is dying. Okay? Yeah, if you don't see patient with breathing problem, airway problem, respiratory problem, and you see that word hemorrhage, please look into that answer very well. It might be the inviting answer, it might be the right answer. And the kind of stool that you see when a colostomy of the descending colon, when a patient have a descending colon, please, you should know the kind of stool this person will be making. Is very, very important. Okay? And how much water you need to irrigate a colostomy, a stomach. Please, you need to know that. You need to know that. The level of the irrigation bag, I'll give this as a giveaway, should be at the shoulder level. The shoulder level. Okay? Yeah. I know a lot of you didn't expect me, but I know people will watch this later. I know. When a question asks you about hepatitis A, B, A for anus. So it's contacted through, you know, the fecal. Yeah, I just want you to know. Yeah, when you see that hepatitis A, just know it's for anus. So think about anything that comes from the anus. And B is for blood. Think about the anything that you can contact through the blood. Okay, I want to make it very, very easy. Then for C, just say contaminated. Contaminated both blood. Okay? Yeah, is contaminated. Just say CB for C and B. Okay? All right. Also know that when a question asks you, like a patient um is having a tarry blood, eh? When it's from when it say tarry, you know it's coming from the GI, the upper GI, the upper. Okay, when it that makes it tarry, and when it is fresh red blood is coming from the lower GI. How I remember it those days in school is when it is tarry black, that means it traveled a long way from up. But when it is bright red, it's just down there, just down there. So it didn't travel, it didn't have to stress. So that's why it's not black, it's pure red. Hmm? Yeah, these are the kind of questions you need to know all this. Yeah. And when someone is bleeding bright red blood, that is a when someone is vomiting bright red, that is a rapid bleeding, and you need to call the LVNs. You need to call your RNs, and the RNs, you need to call the physician. Quick, something is wrong with that person. Please, when someone have ulcer, peptic ulcer, any kind of ulcer, please tell this person to do what? Stop smoking. That is your nursing teaching. You stop smoking. Stop smoking. Smoking is causing your ulcer. Nurses teaching. Stop smoking. One, reduce stress. Stress causes ulcer. Okay? Do not drink alcohol. Just make it plain. You drink alcohol, stop drinking alcohol. All these questions you see, like this kind of questions on your SATA, on the select all that apply. And do not take aspirin. I've said it before. Any medication that causes bleeding, please do not take it. And also, when a patient have pancreas problem, also tell the person to stop drinking, not reduce. If you see that word reduce, don't take it. It's always stop. Yeah, you don't tell someone who have pancreas problem to reduce alcohol. If you see it on your selector that apply, don't take it. If you see stop, yes, tell the person to stop, because if you don't stop, this is going to get worse and you might die from it. And which blood group is a universal recipient? Please try to know all these little points I'm giving this early morning. You will need them very, very soon. I have asked about the blood. How long should the blood be infused? From the time you bring out the blood from the blood bank and the infusing time, what time should it be? Please answer that question. Make sure you know it. Make sure you know it. Oh. When someone have a suppressed immune system, please do not give that person any kind of life vaccine. Please do not. Yeah, do not. Sometimes they award the question to look very, very beautiful. Do not. Yeah. And I'll give this as a giveaway. Hemophilia. Hemophilia, when someone have a hemophilia disease, is just a bleeding disorder. Okay? Yeah, you don't need to go and start reading all the books in the world just to know what that is. They just that the person blood is not clotting very well. It's not clotting very well. And is an inherited disease. Okay? Yeah, is an inherited disease. Please, the mothers, the mamas, give it to their male children. Just know it. Please don't get it mixed up, okay? for hemophilia disease is a bleeding disorder. This person's blood doesn't clot like normal. Like when something cuts you, it takes about 11 seconds. It should clot. It should clot. It should stop. The bleeding should thicken and stop. And if it passes 11 seconds and keep bleeding, that is the disease I'm telling you, okay? The blood doesn't clot when it's supposed to. And is the mothers gives it to their male children. Someone just came across that question, I think last week. Yeah. And please, as a nurse, what will you teach the mother of a child with hemophilia disease? Tell mama, tell the mother, tell the father if you are teaching, just the parents, if teaching any of them, tell them, do not let your child to play soccer. Do not. You don't need to play soccer. You don't need to play football. Anything contact sports, do not. Because you don't know, someone can mistakenly hit the child and the child will start bleeding. And maybe there is no emergency around that might kill that child. That might kill that person. Okay? Yeah. So I'm doing this as a giveaway this night. Yeah. I just want to do this for 1 hour. For 1 hour. Okay, I'll give him that. Yeah. Why do uh let me say okay, why do we do pap smear? I want to put everything in a very simple word so you don't need to go read, okay? Yeah, why do we do pap smear? You know why? I'll give that a as a takeaway. We do pap smear just to dictate cancer. Cervical cancer, okay? Yeah. It is done from 18 years when someone is sexually active. Someone just got that question. When the person is sexually active, yeah, is done yearly. Okay? Where everybody knows about breast examination. I don't want to waste time on that. Oh, the common site. Please, excuse me, when you are working on a patient who is on radiation, you are working on a patient on radiation. Remember, you are going in with your apron, right? You are going in with your apron. Please do not turn back. Do not do what? Do not turn back to that patient. You will get radiated. Do not turn back. You will get radiated. That would be the wrong thing. If the question is asking you what the nurse did wrong, please, that is what the person did wrong. Do not turn back on a patient who is having radiation, because that apron you have on is to protect you from getting a lot of radiation while you are working on that patient. So for you to turn back, you see, you are getting radiated at your back. Please don't do that. That is a wrong answer, okay? Yeah. So if it's for the nurse to intervene, that is what you will do for a nurse to intervene. When you turn back and I'm passing, maybe I'm just walking past and maybe I peeped through, I saw you, you turn back. I'll say, hey, please, why don't turn back? Or I'll say, excuse me, maybe I'll take the apron and put on and I'll let you go because you have getting more of radiation than you're supposed to. Um, yeah. When a patient is suspected of kidney stone, yeah, they can say calculi, but I just want to use the normal word that you know, kidney stone. What do you do as a nurse? What you should do is to strain all the urine, and you are searching for the stone. You want to see if the person pass out the stone. Sometimes it will be at the base of the foley. But when the question like that comes, all you need to do is straining all the urine. You want to see if Miss Linome has passed out that stone that is causing pain to her, okay? That she's getting treatment for. Yeah, okay. Please make sure you read about diabetes. I can start giving you everything about diabetes, but I'll give you the treatment of DKA. If you want to know more, McClement treated this very, very well on endocrine system. Please go and listen to it. Yeah, Marcusmo. You need to go and listen to that class for endocrine system. Okay? Yeah. In your study, make sure you know about the glaucoma scale. Please know it. You just need to know it, okay? And the cranial nerve I bring back to, because when you're talking about glaucoma, the cranial nerve comes in. You need to know the cranial nerves, which one controls which. You need to know it. I don't want to start talking about it now. You need to know it. When a patient is having seizure and the question asks you what you should do first. A lot of people got this question last week. The first thing you should do when a patient is having seizure, the first, please make sure you take away anything that you think that will hurt or injure that patient. That should be the first thing you do. Do not, please, that's the first thing. Do not start moving the patient around. No, move out anything that you think, any object that you think that can hurt that patient. Move it out. Then secondly, you turn the patient on the side, okay? It's very important. And please always stay with your patient, your seizuring patient. If you see the answer that says stay with, please, you have all the time. On NCLEX is a perfect word. Please stay with your patient. Please, and why you turn that patient on the side is to prevent aspiration. So this person doesn't aspirate on their own saliva and die, or secretion, whatever you call it, and die. Okay? Yeah. Dilantin is the drug of choice for seizure. Please, you have to know it. And when you are giving dilantin, please, that person, you need to give a very good mouth care. Very, very, very good mouth care when someone is on dilantin. Yeah. And if the option of mouth care is not there and the option of visit the dentist is there, take it. That is the answer. When that any patient who is on dilantin, if you don't see give a good mouth care and you see um instruct the patient to see their dentist frequently, that is the answer. Okay. I'm almost done. I really want to give a lot. Please, no, read on Parkinson disease, please. Study, go and study on Parkinson disease. It's very, very important. What is tension test? Tension, TENSION. What is tension test used for? Why do we do tension test? You need to know it. It's very important, okay? Bell's palsy. You need to read on Bell's palsy. Very important. And what cranial nerve? You see why you need to know the cranial nerves. What cranial nerve is affected on Bell palsy disease? When someone is having the Bell palsy, what cranial nerve is affected? Please, you need to know that. And your teachings, I will give this teaching for free. I want you to go know what cranial nerve is involved. Now, I'll give this for free. Nurses, teach clients with Bell palsies. It usually lasts 2 to 8 weeks. Clients should prevent the corneal drying up by using artificial tears or manually closing eyes if necessary. Please tell the patient, any patient who coming with Bell palsy and getting discharged, tell the person, make sure you go to the pharmacy and buy, or you go and pick up the eye drop that was prescribed to you, because you need that eye drop. Okay, you need it to prevent your eyes from drying up. It's very, very, very important. Okay, I have 3 minutes. I want to keep to my word. This is just free of charge. Yeah. And please make sure you know the early symptom of compartment syndrome. I won't give that away. You should know it. Yeah. When a patient is requesting for medication for pain, it was time to give that medication, you gave it, and in 5 minutes, 10 minutes, 30 minutes, this patient start calling you again. Oh, I'm still in pain. Oh, that pain is not relieved by what you give to me. Oh, yeah, yeah, yeah. Even screaming on top of the voice. Please, you should know that that patient is having compartment syndrome on that location of the body where the person either have cast, mostly cast, or please. And when you use tourniquet on someone, please don't leave tourniquet for a long time. As soon as you're done with drawing, immediately you get in your needle. Take out your tourniquet. Don't kill those nerves. Don't kill those nerves, okay? It's very important. Yeah. Any question that says you turn your patient every 4 hours, 6 hours, you should know that that answer is wrong. You reposition every 2 hours, because You're trying to prevent pressure ulcer. Very important, okay? Phantom pain is very real. Please, phantom pain. You know what phantom pain is? When someone have a below the knee amputation or any kind of amputation, arm amputation, any amputation, and that person still tells you that they feel pain on that amputated extremities or wherever the amputation was done. It is real. It is real pain to the patient. Yeah, please encourage that pain. Ask the patient, how is the pain like? Is it stubborn? Is the this? Please encourage. That's the kind of grief you need to encourage. And please medicate that patient accordingly. If that patient have a prescription for that, please, please, I am begging you, give that patient that medication after you have done what? Assessed that pain. Is very important. Do not doubt that that patient is experiencing that pain. Please, do not doubt it. Yeah. After an amputation, the first 24 hours, you raise the residue, the remaining of that like that extremities that was amputated, the remaining of it, you raise it up in the first 24 hours. After 24 hours, that patient should be on the prone position. Okay? Yeah, you want to prevent spasm. You put that patient on prone position. All right. Okay? That is good. Is 101. I have gone above my time. I said it was going to be 1 hour and it's already 1 hour. Maybe I will show up again and give us more tips. I got to go right now. Thank you all. Even though you didn't know I was going to come and you showed up, maybe I'll come back again. I still have a lot of tips to give. These are the little things you think you know before you go for your exams, but you don't know it. That's why I am showing up here to give you these tips. It's very, very important. All right. Thank you all for being with me. 22, okay. Thank you for being with me. And with that, I said, good morning to you all. Bye.